we've managed close to 4,000 patients in our office, and with a vast array of conditions, from the children with cancer and Dravet and Lennox-Gastaut, which are severe intractable seizures where they have 20 to 300 seizures a day, all the way up to all the way up to the octogenarian with Parkinson's disease. Mm-hmm. So, and everything in between, patients with Alzheimer's, patients with post-traumatic stress disorder, multiple sclerosis, Crohn's disease, ALS, Lou Gehrig's, anyone, Huntington's chorea, Tourette's, a lot of neurological, because again, the cannabis helps control this severe neuropathies or pains or movement disorders.
Hi, this is Dr. Ross Carter with the Regenerative Warrior Podcast. My guest today is Dr. Joseph Rosado. Welcome to the show today.
Good morning, or good afternoon, rather.
Good afternoon. I guess it depends on where you are.
Exactly.
All right. So today's topic is going to be about cannabis and the use of it in regards to stress, anxiety, depression, which, with the crazy times right now, especially, I don't know when anybody's watching this, but right now we're at the kind of the peak of the coronavirus here in the United States. We're kind of on lockdown, and it can be very stressful for a lot of people. And it can, especially if you're alone. I mean, imagine the people that are alone and they're going through sadness and depression, and, everybody is avoiding them, which is, not fun when you're alone. Fortunately, I'm married, so I don't have that problem. But right now is, the stress levels are, can be very high depending on, your business. And so I think this topic is going to be very helpful. So tell us a little bit about your background in this area and how you got involved in cannabis to begin with.
Sure, absolutely. I am a primary care physician by trade. But in 2010, when medical cannabis became legal in Arizona, one of my best friends reached out to me and asked me to be the medical director for a company that he was on the verge of starting, because the law read that you had to have a medical director for any dispensary, any companies.
Oh, sure.
And so he asked me to be his medical director. I said, absolutely. And so we started looking at the possibility of me relocating to Arizona, setting everything up. However, at that time, his wife said, I don't feel comfortable engaging in this type of activity or this type of a business with our kids being teenagers. It's like, okay. And we just kind of tabled it. Fast forward to 2014, when I started seeing the advertisements on TV for the decriminalization of medical cannabis in the state of Florida, I reached out to John Morgan, who was putting on the campaign and funding it, and said, I'm a physician, I'm an advocate, how do I get involved? And within a week, I was on the Bureau of Speakers, and pretty much the rest has been history. Wow. As a result of that and that exposure, I was the first in the greater Central Florida area to recommend medical cannabis to an adult patient. And I was the first in the state of Florida to recommend medical cannabis to a child, a 15-year-old that had a stage 4 rhabdomyosarcoma, a very, very aggressive tumor of the head and neck that had eaten out his jaw, his cheek, his eye socket. He'd lost his eye, and the tumor had penetrated into the brain, had eaten the skull and was into his brain.
Sorry for the interruption again. To find out more about this speaker, become a speaker on our show, have Dr. Carter present at your event or podcast, learn more about coaching, consulting, tissue allografts, exosomes, supplements, legal help, or how to create $1 million business card and dominate your area, we're here to help you. Just text your name and any question to 561-962-1231. Write that down. That's 561-962-1231. Or go to our website at drrosscarter.com to learn more. On with the show. Now, why would someone prescribe cannabis for that? What did it do for the child with that condition?
Okay, well, the first thing we have to explain that we do not prescribe.
Oh, okay.
Medical cannabis in the United States, and I'll explain why. No, that's a very, very good.
Sure.
That's a good mistake you made, because it's a great segue. As physicians, it was
intentional. That was all intentional.
As physicians, we cannot prescribe a Schedule 1 drug because it's a violation of our DEA. So we use our First Amendment right of freedom of speech, where we recommend to patients the use of cannabis.
We're not prescribing it. We're just saying, here, you can go and you're approved to get it from a dispensary. Is that accurate?
Right. Here's a recommendation. Here's a recommendation. And with that recommendation, you're free to get your medical cannabis. Therefore, that 15-year-old child that received his medical cannabis, it was mainly to help his pain level, because when he started with me, he was on a morphine pain pump, and was receiving 16 milligrams of morphine via bolus every X amount of hours. And once we incorporated the use of the cannabis, he was able to lower the dose from 16 to 8. And by doing so, it then gave him a better quality of life, because now he was awake and alert. At 16 milligrams every 2 to 4 hours, he was laying in his hospital bed, drooling, looking at his crotch. But by being able to wean him off of it, it managed his pain, but it opened up his appetite. He was able to eat, and he was able to leave his bedroom and participate with his family.
So it gave him a quality of life that he would not have had had he not taken it.
Correct.
And it obviously didn't really fix anything that was going on. It was just a way to tolerate the pain that he was going through. Is that correct?
Right, because again, it opens up your appetite, and we've known about that. And conventional medicine has known about it for years, because we've used Marinol, Dronabinol, and the FDA approval for that is for HIV/AIDS patients with wasting syndrome, patients on chemotherapy, that have anorexia, as well as for the nausea and vomiting related to the chemotherapy.
Perfect. Okay. So that's basically what one of the ways you can help or that it can be used is through pain. But how does it help with, say, depression? Is first of all, like alcohol is a depressant. Now, what is marijuana considered, or whatever cannabis considered?
Well, cannabis has been considered a quote unquote downer, because it lowers it lowers revolutions, which is why it's so instrumental in patients that are undergoing stress and anxiety.
Okay, that makes sense. But why would you do it for depression, though? Because it sounds like it would worsen it.
In a very small percentage of the cases, it can worsen it. And a study was done last year. It was published last year in the Journal of it'll come to me, Journal of Affective Disorders. That's it. Journal of Affective Disorders in September of 2019. It was published. They gathered a group of individuals that had stress, anxiety, and depression, and as you agreed and affirmed that with patients with stress and anxiety, their symptoms improved by almost 95%. 93.5% of the individuals that used cannabis had an immediate reduction in their stress and their anxiety.
That makes sense. That makes sense. And does it have a longer? How long's the effect for? Is it just when you're using it that
It
day?
de- well, it depends on the mode of administration that you're
Okay.
using.
Yep.
For example, if you inhale it, which is the second fastest route of administration,
Hmm.
the effects take anywhere between 3 and 10 minutes.
Hmm.
However, it only lasts 2 to 4 hours.
Right.
Whereas if you put a sublingual drop, get a dropper and put some cannabis oil under your tongue, it'll take about 45 minutes to kick in, but it'll last 4 to 6 hours.
Oh, okay.
If you take an edible in the form of a gummy or a capsule,
Right.
it's going to take about 2 hours to get into this for it to get into the bloodstream, but that can last anywhere from 6 to 12 hours, depending on how you metabolize.
Got it.
So,
So for medical purposes, I would say you would want something for a longer effect, right?
well, for medical purposes, we would treat it and we manage it the same way we manage chronic pain, where you have a long acting pain reliever and a short acting pain reliever for breakthrough pain.
Mm-hmm.
So, what you in essence would do is you would have, I have patients do the inhalation and either the sublingual oil drops or the capsules simultaneously.
Oh, there's capsules.
Yes, there's capsules available in the state of Florida.
Okay.
And so what the patient does is they do both simultaneously. They get the effect of the vapor within, or the inhalation within 3 to 10 minutes. It lasts 2 to 4 hours, but as the effect of the vape is wearing down or is wearing off, the effect of the sublingual oil or the capsule is kicking in. They're covered better, they're covered longer, and then that capsule will cover them for those 6 to 12 hours, depending how they metabolize. However, if they have any issues in between that time frame, they can grab their vaporizer pen, whether they do vape concentrates or they vape the flower, but they hit the vaporizer pen and they get that effect and they cover it. So let's say someone suffers with severe anxiety or stress and they're covered, but they all of a sudden feel like something is going to overwhelm them. They're on the verge of having a panic attack. They immediately grab their pen, inhale, and within 10 minutes, they're back to that baseline.
That makes sense. Okay. So what, I guess, what are the primary people that this is really a beneficial for? Just people that are just high stressed? Does it, my thought as an entrepreneur, I guess, is that stress kind of keeps me motivated. Will it demotivate you just to not want to work or do things, or what? How does that work?
Well, with some people, stress can lead to agoraphobia, and that leads them to have panic attacks.
Yes.
And so any amount of stress makes them, for someone such as yourself and myself, we use stress as a driver. It
Right.
drives us to get to that next level.
Mm-hmm.
It gives us that energy. Others, it paralyzes them. For years, when I first started doing public speaking, and I was speaking to some of my my medical professors and colleagues, they would take a low dose beta blocker before they would go on stage.
Oh, yes, to lower their heart rate.
Exactly. And it would keep their heart rate at a low rate, so that way they would never go into tachycardia, and it would keep their anxiety under control, because they had social anxiety disorder. They were afraid to get on stage and speak.
Right. So a lot of people I know are involved in the CBD market. So tell me, how is this different? What's the advantages and disadvantages of either, and how do they work together or apart? What's the differences?
Okay. Well, we've got to go back to the plant.
Go ahead.
So the mother plant is Cannabis sativa L. Okay. And so the way I explained it in my book that I published last year on 420, 42019, not a coincidence,
Come on.
but the title of the book is Hope and Healing, the Case for Cannabis. And but in the book, I explain, and I have pictures, but you start with the mother plant, which is Cannabis sativa L. And that mom had a set of twins, a male twin and a female twin. The male twin was tall and thin, and they called him hemp. The female twin was short and thick, because girls aren't fat, they're thick. And her name was Cannabis. Hemp is primarily and predominantly CBD. Up until December 2018, before the Farm Bill 2018 was signed into law by President Trump, it was illegal to grow hemp in the United States.
Okay.
And so people were buying hemp from China, from the Ukraine, with questionable growing practices. And when they were coming to the United States, they were extracting the oils from that hemp. And as a result, there were a lot of patients that were getting ill because they had some heavy metals in there, some arsenic, some lead, some mercury, as well as pesticides that are not used here in the U.S. And so people were getting ill with that. And so as a result of that, among other things, Farm Bill 2018 was signed into law. And now hemp can be grown in the U.S. and oils can be extracted from the hemp. And from there you get CBD. Now, you have three different tiers. You have an isolate, a full spectrum, and a broad spectrum. Isolate, the word says it. It just isolates CBD, but any phytocannabinoid. It can isolate CBG, CBN, THCV. These are all letters that are found, or phytocannabinoids. Phyto meaning plant, cannabinoids, structures that work on the cannabinoid receptors in our body, because we produce cannabinoids, not THC or CBD, but anandamide, 2-AG, and these were discovered in the early 90s. Now, you have the isolate, you have a full spectrum, meaning it has everything, as well as 0.3% THC, which is allowed by law in a full spectrum. So it cannot have more than 0.3% THC for it to be sold over the counter. So you have your isolate, which isolates CBD by itself, a full spectrum, and then the cross between the two is a broad spectrum. It has all of the benefits, everything that's found in a full spectrum without any THC. This leads to one of the questions you asked about working together or by themselves. It's better for them to work in conjunction with each other, because there's a theory called the entourage effect, where each one potentiates the effects of the other. So it works better in conjunction. It's better to do a full spectrum, or it's better to do a full spectrum with a little higher THC. You don't have to go to a 37%, 34 to 37% THC. You could be down in the 5 to 10% range, but in conjunction with all of the other phytocannabinoids to work on the different receptors. THC works primarily on the CB1 receptor, which is found primarily in the brain. CBD works primarily on the CB2 receptor, which is found in the peripheral nervous system.
Okay.
So CB1, brain and spinal cord, CB2, peripheral nervous system, and the immune system. So the white blood cells, the reticuloendothelial system, which is made up of the spleen, the thymus, the tonsils, etc.
Okay, so what is the differences for use? Which one would you use for what?
It depends on the condition of the patient. It depends on the situation of the patient. It also depends on what the patient does for a living. If someone is a first responder and they are randomly urine drug tested, then that person cannot be on anything that has any cannabis in it. So those would benefit from either an isolate or a broad spectrum.
But are they doing similar actions? Are they both for pain management?
CBD works more as an anti-inflammatory. It has an anti-inflammatory and antioxidant effect, whereas THC tends to have more of an analgesic effect.
Okay. So you would use CBD for inflammation and
To block the stress oxidative, the oxidative stress that goes on from day-to-day life of any type of stress, physical, mental, emotional.
Gotcha. And the cannabis would be for more the anxiety ridden issues.
Correct. Yes, exactly. For the anxiety issues, for the cancer patients that have the nausea, the vomiting, things like that.
That makes sense now. I've never known the difference between the use of CBD and cannabis. And so you're saying cannabis is actually female. Is that what you were saying with the plant?
Correct. Cannabis is a female plant. And so from cannabis, then you get the subspecies, which are the sativa, the indicas, the hybrids, and CBD as well. So you can get all of that from the cannabis side of the spectrum. So you have the family, the genus, the species, the subspecies.
Okay. So when somebody gets cannabis, is it like a set amount of each, or how is that determined?
In the state of Florida, there are rules and regulations. So, for example, if we recommend the flower, we are only allowed to recommend 2.5 ounces every 35 days. That's how the law reads in the state of Florida.
Okay.
So that's what they're limited to.
Okay.
If you go to a state like Colorado or California, that doesn't exist.
So a lot of my listeners are in the medical medical professionals. What do you think, let's say if somebody is a doctor and they're thinking they would somehow want to be involved in this to help their patients, or what steps should they go through if this is something they want to add to their practice or refer out? What's the thoughts there?
Well, I consult physicians on the use of medical cannabis, not only in the United States but abroad. As we started the show, I've been teaching internationally. Last year, I went to 7 countries and 3 different states, speaking to physicians on the use of cannabis in their private practices. So if there's a physician out there that is looking to get involved in this or has been involved but doesn't really know how to manage their challenging or difficult patients, that's where I come into play. We've managed close to 4,000 patients in our office, and with a vast array of conditions, from the children with cancer and Dravet and Lennox-Gastaut, which are severe intractable seizures where they have 20 to 300 seizures a day, all the way up to the octogenarian with Parkinson's disease. Mm-hmm. So, and everything in between, patients with Alzheimer's, patients with post-traumatic stress disorder, multiple sclerosis, Crohn's disease, ALS, Lou Gehrig's, anyone, Huntington's chorea, Tourette's, a lot of neurological, because again, the cannabis helps control this severe neuropathies or pains or movement disorders.